this is Sarah Mikesell with the Pig Site, and today we're here with Dr. Jeff Zimmerman. He is with the Iowa State University Veterinary Diagnostic Lab. Thanks for being with us today, Jeff.
Sarah, it's great to be here with you.
Thanks very much. And we're here in Chicago at the North American PRRS Conference, and there is a lot of talk about diagnostics. Let's talk about kind of the history of surveillance and where we're headed with that.
Sure. That's a great topic, Sarah, and it's very timely just because as we're looking forward to trying to control or prevent African swine fever, we have to tailor our surveillance to the industry and the purpose for which we're using it. So just to give you a little thumbnail sketch of how surveillance has changed over time, I'd like to have you remember the hog cholera eradication program in the US, which was successfully completed in 1978. That particular program, the surveillance method was to test every pig in the herd, if you can imagine. But herds at that time were about 50 pigs, relatively small. When we came to the pseudorabies eradication program in the early 80s, the discussion came up, do we continue sampling every pig in the herd, or do we use a new technique? And thankfully, they used a new technique, which was representative sampling. So instead of sampling every pig in the herd, they took a subsample. And most of us know that the subsample was usually 30 pigs. So if you went into a barn of 1,100, 1,200 pigs, you'd sample 30, not 1,200. So now we're at the present time, and things have continued to change. For one thing, our herds are typically much larger. They're much more complex than they were even in the 1980s. And so now we're looking at surveillance, preventive surveillance for African swine fever or classical swine fever. And so we need to change again. One of the things we've seen is different sample types. In classical swine fever, hog cholera, or pseudorabies, it was only serum samples. Today we need to use other kinds of samples, and that can be processing fluids, can be oral fluids, can be tongue tips, or any of another variety of aggregate samples that we're developing. The other thing that we're having to change, or we need to change, if we're going to have an effective but also affordable surveillance program, is we need to change how many samples we collect. In the pseudorabies eradication program, every herd got tested at some interval, usually once a year, sometimes more often. In the case of African swine fever, classical swine fever, what we're going to have to do is we're going to have the producers themselves, working in coordination with their veterinarians, collect a limited number of targeted samples. So in most cases, we're going to ask for perhaps 10 samples from poor-doing pigs. What we've seen over time is that, and even as the Europeans are recommending, if you target the poor-doing pigs, it increases the probability that you'll actually find the sample. We reduce the number of samples per herd, but we're asking for more participation. So in other words, we'd have a surveillance program set up where most of the herds would test at about the same period of time. That gives you a very sensitive, very detailed picture of what's going on in the system. It turns out that if producers would collect those 10 samples, pool them in 2 samples for testing, the cost on a regional basis is about 1 cent per pig in inventory. So it's a pretty cost-effective thing. It's also relatively easy because we're using samples that are easy to collect. It could be oral fluids, it could be oral swabs, other simple to collect samples. But the overall sensitivity of the system is magnificent, to be honest. And so this is the kind of procedure, the kind of approach that US SHIP is going to be using, is going to be recommending for our ongoing African swine fever, classical swine fever surveillance.
Very good. And I guess one question I have is you're kind of talking through this is this a program that would go into place if African swine fever were found in the United States, or is this something that's kind of preemptive and proactive that we're really trying to monitor and surveil all the pigs across the country right now?
That's a great question. So that program will be driven by US SHIP, and of course US SHIP has a representation of producers, veterinarians, state and federal government, and so the committees from US SHIP will decide when that program, when that surveillance testing would go into place. So it's not an answer that's set in stone right now. It's going to be something that the producers themselves, in coordination with federal and state government, is going to decide.
Very good. And for our producers in the United States, there's a lot of different things they're being asked to do right now. There's a lot of sign-ups and different things that go along with this. Tell us just a little bit about SHIP and what that is, and how does the producer become involved with that?
Sure. Well, U.S. SHIP stands for Swine Health Improvement Plan, and is really modeled after the National Poultry Improvement Plan, which has been around since around 1935. So it's got 80 plus years on it. NPIP, the poultry side, is based on the same model. So it's producers, packers, state and federal veterinarians coming together to decide how they best want to control disease, how they want to improve the health of the industry. And so U.S. SHIP is on the same model, and so it will proceed in the same fashion. So the producers will be involved in making those decisions. The producers themselves can become involved in SHIP and are encouraged to become involved in SHIP. They can contact their local producer organizations. National Pork Board, for example, has lots of information about U.S. SHIP. Also, their local and state animal health officials will have all the information they need to get signed up, because ultimately we want producers to be signed up.
Right. It's so important that producers sign up now before something like African swine fever hits, right?
Right. That's correct. We need these parts in place. Even if we're not conducting active surveillance, if the parts are in place, we can quickly implement the program and find out exactly where African swine fever or classical swine fever is at, so we can take decisive and effective action.
Very good. Excellent. Well, thank you for all the information today.
Thanks for giving me the chance.
This is Sarah Mikesell with the Pig Site.